Welcome to Mental Health Matters. I'm Barbara Meyers. On today's show, we'll be talking about eating disorders. We are honored and privileged to have two guests to discuss this topic. Julia F. has lived with eating disorders for much of her life. She has led an eating disorder support group and is now in recovery. Welcome, Julia. Dr. Marybeth Weinstock is a primary therapist on the staff of New Dawn Recovery Center, a facility that treats eating disorders in San Francisco. She is a psychologist and has a master's degree in dance movement therapy. Having been in the dance world, she has firsthand knowledge of the struggles of eating disorders. She worked with Julia at New Dawn. Welcome, Dr. Weinstock. Julia, when did you become aware that you had an eating disorder?
I always knew from age probably 8 and on that I had a struggle with food. The first time that I remember purging, I was 9 years old. However, I think that I first realized that my eating disorder was full-blown and became really aware of the severity probably around age 16 or 17.
Mm-hmm. And how has your life been affected by bulimia and anorexia?
I mean, it's almost impossible to describe because the disease has affected every area of my life. I almost don't know what my life would have been like without it. There's no, eating disorder and then my life.
Yeah.
It's like, it's all happened. The eating disorder has been such a driving force, such an instrument of expression and coping, and just this lens through which I've experienced my life and the world, So I mean, health, relationships, school, work, my thinking, my feelings, you name it. It's all been colored by the eating disorder.
And I understand that you have both anorexia and bulimia. How are those two related for you?
Well, interestingly for me, I definitely had anorexia develop first and was just, anorexic for quite a while, probably about 5 years. I was just anorexic, no binging, no purging behavior. But I think that anorexia and bulimia are sort of two sides of the same coin. And my experience has been that when I am in a mode of restricting my food and also just kind of restricting, the anorexia, we restrict our feelings and our passions and we really restrict all these different aspects of ourselves. Eventually, the pendulum is going to swing back the other way, and I did end up developing severe binge purge bulimia, and I think that, like I said, that they're two sides of the same coin in that way. You sort of, I think it's very common to sort of flip-flop between one and the other, and that's what I've done.
Okay. Well, when did you first try to receive treatment?
I first went to see an outpatient therapist. That was my first step. I think when I was 17, maybe 18. And I did go off to college, and I continued to see a therapist in college and also began to see a nutritionist as well. But I was very, very ill at that point and got down to an extremely low weight, which was a weight that was unsafe for me. So my therapist recommended a higher level of care, and they kind of shipped me off to this treatment center in Arizona. Wow. And, the first try at treatment was not successful for me in a sense that the behaviors continued and actually worsened. I went to 2 different treatment centers around that time. And I sort of see it today as just part of my process. I was learning a lot and soaking in a lot throughout those experiences, but I was not quite ready to challenge some of the core issues and to give up the behavior.
I see. So Marybeth, can you tell us a little bit about what eating disorders are?
So we, as professionals, we define eating disorders using the Diagnostic and Statistic Manual of the American Psychiatric Association, the way physicians have their desk manual that they use for diagnoses. That's what we use. And accordingly, anorexia has certain criteria that we base our diagnoses on, and bulimia does as well. Anorexia is, as Julia was saying so articulately, it has to do with restriction. There's often a really compulsive element about losing weight, that there are a lot of obsessive thoughts about weight gain, and lots of focus on particular parts of the body. And it can seem very irrational to the people who are witnessing the anorexia, but to the person who has the anorexia, it doesn't feel irrational. It feels like everybody else is irrational. And it's very difficult to treat at first, as Julia was just describing. It's people go through a stage that we call pre-contemplative, when it's very difficult for them to buy into that there's even anything wrong. And there's a strong physiological component to that as well. And Julia was just saying that they're kind of two sides of a coin. Often when people restrict for a long time, the barometer for satiety that's in the brain gets very wonky, and then people are dying to eat. So that's often when the binge purge cycle will start. It can often start from severe restricting. And bulimia is either binging and purging or extreme binging. So sometimes people who are thought of as compulsive overeaters might be bingers. And there are other criteria that are involved, but that's basically it. So and bingers will eat a very large amount of food in a very short period of time. And there's also something we call grazing, when there can be eating that's going on all day long.
Continually, yeah. Is the pattern that Julia described of starting out as a child, having eating problems, is that typical?
It's very common. It's not what we always see, but it's very common. And we especially see that childhood anxiety and sometimes depression can be correlated with eating disorders, but there's usually something that we see early on. Most of the time there's something traumatic that happens in puberty, or something really difficult happens just when the body is changing into an adult body, and then the restricting can start to happen then, because there's this fear of going from a child's body or a pre-adolescent body to a body that's fully in adulthood. When there's normal weight gain and all kinds of hormonal changes, it can really kick in then. So
is it common mostly with women, or is it in certain age groups, or what?
It's cross gender, cross culture, cross age group, but we do see more. This could just be because of the awareness, but we do see more young people certainly these days with eating disorders. But I'm sure there are women my age who have had them for years, and there's just was nothing done about it because the awareness wasn't there. But there is definitely an epidemic now, and way more in women than in men, but there certainly are plenty of men.
I was interested to learn that you combine a variety of different approaches. I understand your orientation includes psychodynamic, Jungian, feminist, cognitive behavioral, and existential approaches. So how do you decide what therapy to use with a client? For example, how did you decide what therapy to use with Julia?
Well, Julia, it was kind of a no-brainer. Julia loves to move, and she's a really gifted mover. So using a very embodied approach with her was...
So you combine dance with what you're doing?
I do, as a dance movement therapist. Sometimes it's just talking, but even when I'm just talking, I can't help but bring in some kind of conscious, embodied approach, especially with eating disorders because folks with eating disorders tend to dissociate and not be embodied because it's really scary to be in the body. It's very frightening, even with someone like Julia, who's a very beautiful mover and loves to move. It can be very frightening at times to be in the body. So I always involve some component of being in the body consciously, whether it's even just taking a few deep breaths and saying, feel your breath, connect with your breath. So that there's some moment of having a positive connection with being in the body, feeling bodily processes. Yeah, so that's a very important component. And then in terms of what approach I use, it depends on the person who's in the room and what they respond to.
So you tailor it to each person.
I do, and the group, there can be sort of a group feeling. I talk to people, I ask them what feels comfortable to them. At this point, I've been doing this for so long that I find that it's really important just to check in with people and say, what feels good to you?
Julia, did dance work for you when other things didn't? Or?
I think that a combination of different methods and different approaches has worked for me, but what Marybeth is saying is really true. I think that, eating disorders are a means of expression through the body, and so much of my recovery has had to do with becoming embodied and being able to be present in this body. And so, learning how to express myself in that way was hugely helpful while working with Marybeth.
So body image is part of this illness, I guess, and understanding what a safe body image or healthy body image is, I think, could help. Yeah.
Yeah, and it's often the thing that takes the longest to heal. Body image, we predict for our clients, our patients, that how they feel about their body, how they see their body is going to take quite a long time. There's so many factors involved in that.
What role do you think that media images of ultra-thin models and so forth play in eating disorders?
Oh, it so much has to do with the epidemic. You can talk about that from firsthand experience, Julie, but we're so political about that. It totally influences the epidemic that we have right now. What would you say about it?
I mean,
Julia?
I do want to say I feel like these images that we're inundated with, especially during the time of puberty, what Marybeth was talking about, when the body is changing, when you're moving from childhood into adulthood, I remember being really hungry for some type of role model or some type of, guidance as to how I was supposed to be. And these things that I didn't seem to match or measure up to, those were things that I wanted to emulate. And this feeling of not good enough or unsafe or whatever, if I could just be like that, I would be okay. And I do think that that's a big cause. I also think that sometimes the media is blamed or targeted as the cause of the disorder and kind of the root of the disorder. And I want to say that that's not my opinion, that's not my belief. I think that the particular obsessions and the particular manifestations of, women with eating disorders do come largely from these media images, but the core cause, the feelings, the experiences that Marybeth was touching on a little bit, the thoughts of I'm not okay, the experience of being a young woman, or a young man and experiencing pressure or not knowing how to deal with feelings, trauma, childhood trauma of any kind. Those things I think are more what is at the root, but I think that the media images, contribute to how, these things are expressed. Yeah.
Okay.
I would add one more thing to that if there is a predisposition, I actually, I think that a lot of the images, like women being a size 0, that's not even it's not even a number. It's like not being an entity. That there's a lot of greed involved in that in terms of advertising and what's pushed, and diet products and laxatives, and that's pushed, and they'll use that vulnerability that's in our culture right now to push the product and to sell it. And it's very disturbing. I really believe it's very misogynist, so that feminist philosophy can kick in very strongly when you go through this journey and when you witness the journey. It becomes very enraging to see what's pushed upon young people, and not just young people, older folks as well, that it's not okay to age, to just age naturally. And it makes people feel like they have to do a lot of things and buy a lot of products and go through a lot of procedures instead of just being themselves. Like, I'm good enough as I am.
Yeah, and I guess eating disorders are different from other kinds of addictions in that everyone has to eat. So, with someone has an alcohol addiction and they just don't have alcohol, but if you have an eating addiction, you have to eat. So it's, how do people feed themselves the needed nutrition without unleashing addictive behaviors? That must be difficult.
With lots and lots of guidance. It's really, really tough. It's exactly as you said. And especially with eating disorders, often when we call it refeeding, when people start to eat again, to eat in a normal way and just learn to eat 3 meals a day and have snacks in between and watch their weight start to normalize out. Often anxiety has been suppressed through the eating disorder, and so that'll come flooding up, and there will be this, oh, wait a minute, I don't have the thing that I was using to suppress the anxiety, and yet I have to eat it. And so it's very difficult, because with other addictions, when there are substances involved, if the substances are put aside, the coping skills that are used, you can't grab the substance, but you have to eat the food to live.
I can definitely speak firsthand about this because I've struggled with other addictions as well, substance addictions, and had a lot of success in my recovery from that as well. But I can say that the food has been by far, it doesn't even compare to me. It doesn't even compare as far as the process and how difficult that is. Refeeding, I've been through it a few times. The things that Marybeth describes, the physical sensations that happen, and also just the emotions that come up. Sometimes I'd be just crying through a meal, and that would have to happen 3 to 6 times a day, and without proper, help and guidance through that process, it's impossible, I believe, to kind of do it on your own and sort of, make sure that you're eating regularly without that kind of support, because it's true. The trauma stuff, whether it's anger or grief or anxiety, whatever it is, it's going to come up once you start eating normally. And then it also takes a lot of discipline and a lot of vigilance after you've sort of stabilized weight, after you've stabilized physically, maybe you've sorted through some of those emotions, to maintain, so that you are getting proper nutrition, and just to sort of navigate through that, okay, is this normal? Is this my eating disorder talking to me? Or is this, the appropriate food for me to be eating? I go through that on a daily basis. On a daily basis. It's not something that I can ever just kind of shut away and not think about.
I understand that it's been a spiritual component to your recovery. Would you like to tell us about that and how important it's been?
Yeah, absolutely, and I think that's a great segue, because just talking about what a struggle it is on a day-to-day basis, and what a struggle it's been going through treatment, having a sense of a kind and loving spirit guiding me, having a spiritual path that I follow and that I can hold on to. It's been like my life preserver in this ocean where I'm just getting tossed around, where no matter how scary it is or how dangerous it feels or how desperate I get to cling on to that. And it's been a source of love and inspiration and guidance. You know, I firmly believe that some type of spiritual component is a very important part of anyone's recovery.
And how important have you found peer support to be? I guess both of you are involved in various peer activities. Or you're involved
yes,
in
I feel like it's absolutely essential. You know, part of the reason being that with eating disorders, there's so much shame involved, and there's such this feeling of, I'm the only one, you know, I'm the only one who does these things, there's something wrong with me, and there's so much secrecy, and that is how the eating disorder is sort of allowed to be perpetuated and sort of to thrive in these dark places, you know, that shame. And so being around other people who struggle and talking about it, sharing struggles and sharing recovery is I think hugely important through, you know, just to see that, you know, I'm not the only one. There is nothing wrong with me, and to support each other on the journey. And also, I want to say that I feel like having interactions with people at various places in their recovery, so people who have been through it, you know, like for me, Marybeth, having gone through her own struggles with food, having that and seeing her on the other side, and speaking to people who maybe have, I don't know, 5 years away from the behavior, or 20 years, or 6 months when all you've got is today. That is incredibly important, just in as far as giving you that hope and that light.
It's so important to point out to people that the trajectory of recovery doesn't go like that. It goes like that. And to be able to share that with one another, so that when a relapse happens, which we always predict it's going to happen, especially when someone's new to recovery, they're going to relapse, just like falling off the wagon with alcoholism. It's going to happen. And so that you get to keep coming back and not have to feel like, oh no, you know, I completely blew it, that I get to do this again, and to watch other people in those stages, and to just, because it can feel rotten each time it happens, no matter how much progress has been made. It can feel like, oh no, I failed. So it's really wonderful to have people as role models and say, no, keep going, keep going. Yes, it's horrible. You'll have to go through feeding again, but it's worth it. Keep going. And to know that there's a whole other life on the other side. And I'd like to add one thing about that in terms of the spiritual component, that we often talk about the not just an outer spiritual component, but an inner spiritual component, that there's this voice inside that's been suppressed, and that when people do go through recovery and find that strong voice inside of themselves, what comes out of someone who's been through an eating disorder, that voice is so powerful, it's so strong, there's such a deep connection because of the struggle. It becomes so poignant that people who come on the other side of it are amazing. There's all this power that's been suppressed and that's been used in other ways, and then it just flows out in I've seen just brilliance. I've often seen just people just flower, and their lives just blossom if they make it through. It's a really tough road, and they have to be very, very determined to make it through to the other side, because it's tough, and some people don't. But we're there to, we're there on the other side to say, keep going. We're here. We're here. Do it.
That's good.
So that's so much about the peer support.
Okay, thank you. What would you say to someone who's watching, who's struggling with an eating disorder?
I would say, I think that the most important thing I needed to hear was that I was not a bad person. So I would say, you're not a bad person. You just have a very, very bad disease. You're not alone. There is a way out, and you are worth it.
Wow.
That's hard to follow.
Yes.
I would say it's not your fault. There are people who are on the other side of it, reaching their hands out to you. Ask for help. You don't have to suffer. You feel that bad because you're suffering with a disorder, and you don't have to suffer with it.
Okay.
There is help.
So what would you say to a family member of someone who has an eating disorder who might be watching?
Just love them. Just keep loving them. I know it's hard. My family went through, so much pain because of my disease, and it is hard. But I think the number one thing is just to love the person who's suffering, support, and there are resources for families as well that I recommend looking into. It is a long process and it does take a whole village, but just be patient, hang in there, and just show as much loving kindness as you can, because they're not doing it to you. It's because your loved one has a disease and they just need some help.
Okay, so
I would say get educated as much as possible. Talking to people with eating disorders requires learning a whole new language, a whole new way of communicating, learn effective communication skills, try not to get into that power struggle, because it's not going to work. It's going to send them deeper into the eating disorder. Get help, get professional advice. Relinquish your struggle to the professionals.
Okay. Well, thank you for those. So there is hope, and I encourage you to reach out to that person who who's struggling for the help that she or he needs. I'd like to tell you about some resources. The Association of Professionals Treating Eating Disorders is a Bay Area organization that gives referrals and providers of programs. Anorexia nervosa and associated disorders that provide education, referral, and advocacy. And the third organization is the National Eating Disorders Association, which supports individuals and families, and it does advocacy for people. In addition to these, the three organizations, there are 12-step groups, Eating Disorders Anonymous and Overeaters Anonymous, both of which have chapters in many cities. And New Dawn Recovery Center, which is where Marybeth works and where Julia was most recently treated, is at newdawnrecovery.com, where you can find that on the web. I want to thank you, Marybeth, and thank you, Julia, for being our guests. I'll end with these closing words by the Reverend Wayne Arneson. Take courage, friends. The way is often hard, the path is never clear, and the stakes are very high. Take courage, for deep down there's another truth. You are not alone. Thank you for watching. We'll see you next time.